Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, let's unpack this a bit. Imagine you're feeling, a bit under the weather. That first thought might be to grab your phone, right? But instead of wading through search results, what if you just asked an AI chatbot for medical advice? Sounds convenient, maybe even quick. But how good is that advice, really? This deep dive looks into a really interesting study that tested these AI medical assistants.
Yeah, it's fascinating because we're looking at how reliable these advanced language models, things like ChatGPT, actually are for something as important as health. We're drawing on a recent scientific paper and a related health news article. They both explored how well these AI chatbots do when real people, like you, ask them for medical help.
Exactly. And our mission here, for you listening, is to sort of figure out if using AI for that initial health question is a smart shortcut or maybe a potential pitfall. We want to give you the crucial insights you need to navigate this.
So let's get right into the study. The main idea was to evaluate the accuracy of the medical info and advice these large language models give out, specifically when the general public uses them in, real-world situations. The researchers really wanted to know if the impressive medical knowledge these AIs show on exams actually translates into helpful advice when they're talking to, us.
And the way they did it, the methodology, was quite neat. They had almost 1,300 people involved. These folks were randomly split. One group used one of three big-name large language models, GPT-4o, Llama 3, or Command R+ for medical advice. The other group, the control group, just used their usual methods, Googling, maybe just relying on what they already knew when given a medical scenario.
And everyone got one of 10 different medical situations. These weren't random guesses. Doctors developed them. They covered a range of common conditions and, crucially, required deciding on the right level of care, needed anything from self-care right up to calling an ambulance.
Right, and to really see what was happening, the conversations, the actual chats between the participants and the AI were recorded. The research team then analyzed all of that. They compared the AI's advice accuracy against the control group's outcomes and also against a gold standard set by a panel of physicians.
The study even went a step further. They tested the large language models directly with the scenarios, no human interaction, just to see kind of the AI's baseline knowledge versus how it performed with a real user asking the questions.
Okay, and this is where it gets really interesting. The findings. When the large language models were tested alone, just given the scenarios, they were actually very accurate at identifying the medical condition, like around 95%. And they were reasonably good, maybe 56 to 65% at suggesting the right course of action.
So on paper, they look pretty knowledgeable.
Exactly. The AI knows the stuff.
But, and this is the really key finding, when actual people interacted with those same AIs, it was a totally different story. The participants' ability to pinpoint the right medical condition, it dropped way down, less than 35%. And figuring out the correct action to take, also down less than 45%, which strikingly was no better than the people just using their usual internet searches or own knowledge.
Wow, that is a massive difference. So what went wrong?
Well, the researchers called it communication breakdowns. It seems people often left out critical information when asking the chatbots, or maybe didn't phrase things clearly. And on the flip side, the chatbots sometimes misunderstood the prompts or gave suggestions that users just didn't follow or understand.
That makes sense. It's hard enough sometimes explaining symptoms to a human doctor, let alone an AI.
And what's also a bit worrying is that the study found using a chatbot sometimes made people less likely to identify their condition correctly. They might even underestimate how serious it was. And in medicine, delays can matter a lot.
Yeah, absolutely. And another surprising bit you mentioned, the standard tests they use to check an AI's medical knowledge, like those benchmark exams and even simulated patient interactions, they didn't predict these real-world failures.
Exactly. It shows testing these things in a vacuum isn't enough. The human interaction component is crucial and complex.
So connecting the dots here, the big implication seems to be that just having tons of medical data, enough to pass exams, doesn't automatically make an AI a good medical advisor for everyday people.
Precisely. That interaction, the way the user and the AI communicate, that's the critical part.
It seems people might not know how to prompt the AI effectively, maybe. Not giving it all the clues it needs.
That's definitely part of it. People aren't trained diagnosticians. They don't always know what details are relevant. But it could also be the AI struggling to grasp the nuances, the intent behind casual language, especially in a high-stakes context like health.
Which leads to potential risks, right?
Yeah.
Relying too heavily on this could mean people delay seeing a doctor when they should.
Or they might try to self-diagnose or self-treat incorrectly based on the AI's suggestions. That's a real concern.
Yeah, these findings really do suggest we need to be cautious. Very cautious about rolling out these AI chatbots as a first stop for healthcare advice. It seems like much more real-world testing with actual users is needed first.
Definitely. And it's not just about the AI listing possibilities. Even if it suggests the right condition among others, people might not know which one is most likely or how urgent it is. They lack that clinical judgment.
Of course, we should also touch on the study's limitations, like any research. They focused on 10 specific scenarios, right? So maybe the results don't apply to every single medical query or rarer conditions.
That's a fair point. And the participants were all from the UK. Healthcare systems, how people seek help, that varies globally, so results might differ elsewhere.
And they used 3 specific large language models. Others might perform differently, better or worse.
True. And lastly, while the scenarios were physician-designed, real-life medical situations can be way messier, more ambiguous than a written scenario.
Okay, so given all that, what did the researchers themselves conclude? What were their main takeaways?
Their big conclusion was that safe, effective deployment of these large language models for public medical help needs more than just knowledge. That ability to interact effectively, to communicate well with the user is absolutely critical. It comes back to those communication breakdowns.
Makes total sense based on the drop in accuracy we talked about.
Exactly. And because of that, they strongly recommend systematic human user testing. Really digging into how well these AIs handle real interactions before they're widely released to the public for medical advice.
So it's not just about the tech being smart. It needs to be a good communicator, a good guide.
Precisely. Future development, they suggest, should focus on improving how the AI communicates, maybe clearer explanations, more structured output, or even more direct, actionable recommendations, rather than just a list of possibilities.
Moving beyond just dumping information towards actual guidance.
Yes. And they also highlighted that the AI systems might need to be more proactive. They need to learn to ask for the right information, to guide the user, rather than just passively waiting for the perfect prompt.
Ah, interesting. So the AI needs to get better at, like, taking a patient history almost.
In a way, yes. And finally, they pointed out that doctors and nurses should probably be aware that patients might come in having used these tools, and those patients might have inaccurate ideas about their condition or how urgent it is, which could complicate the consultation.
Right. So wrapping this up, feels like the main takeaway is that while AI is incredibly promising for something as personal as health, that human element, communication, understanding nuance, it's still replaceable right now.
It really makes you think, doesn't it? What does this mean for using AI in other complex personal parts of our lives? It's a good reminder that technology is a tool, a powerful one maybe, but knowing how to use it wisely is just as important as the tool itself.
So, the bottom line for now. AI chatbots, despite knowing a lot, aren't quite ready to be your go-to medical advisor. Those interaction challenges are still pretty significant.
And hopefully for you listening, this gives you a clearer picture of the current limits of AI medical advice, and really the importance of thinking critically about where you get your health information, AI or otherwise.
Definitely. We've really only scratched the surface here at this intersection of AI and healthcare. It's evolving so fast. We encourage you to keep thinking about technology's role in your health and stay tuned as this field develops.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.